Hello, everyone. Thank you for joining our seminar today. Today we will speak about very important topic. This is about hearing and speech. And after pandemic, after COVID time, it is very important for a lot of people who have some problem with that. And I'm happy to introduce International Center of Hearing and Speech Medincus that's located close to Warsaw in Poland. We had many articles before in our magazine, DoctorGEO&SPA, and many people found information there and they restored their hearing. And I want to present our speaker, Irina Pizhinska. It is a person who caring about your patients when you sending patients for treatment. And this is a person who meet and do everything for your clients be happy. Irina, please.
Yes, hello. As Natalia said, my name is Irina Pizhinska. I'm here. There was supposed to be Professor Skarżyński, but I'm here instead of him, and I'm going to tell you more if you didn't know before us, or if you are the first time and we never ever met before. So I'm going to tell you a few words about the International Center of Hearing and Speech Medincus, and about how we are taking care of our patients and what we are doing in order to give them this good hearing. So the center Medincus is the leader in the advanced ENT care, providing innovative solutions to the patients worldwide. So we are located in Poland. The main center is located here in Poland. It's next to Warsaw. People are saying that it is suburbs of Warsaw. It's not suburbs. This is a small village that is called Kajetany, and the main building, the hospital, the headquarters of Medincus is located here. Maybe it's a village and it sounds like, you know, it can be funny, but people all around Poland, and not only Poland, but in other countries, know this name, know Kajetany, and this is why. So as I said, we are the leaders in ENT. We are providing the healthcare for more than 1,500,000 patients in our network. We are doing more than 150,000 consultations annually and more than 2,500 surgical procedures every year. So different specialists work in the network Medincus. There are ENT specialists, of course, phoniatricians, audiologists. We are providing care for the patients with the hearing aids, with the hearing implants, cochlear implants. We have speech therapists and other people like me, who are taking care of patients not from the medical point of view, but, you know, organizing their stay and their care. And I believe that it is not less important. It's also very important, because not every center has something like this. We have the whole department, international cooperation department, that is taking care of course, international cooperation, and also our foreign patients, patients that are coming from different countries for the care that they are getting here in Poland. And within the network Medincus, there are 18 facilities in Poland. And also we have 7 facilities in other countries. So what is the idea? The main idea that here in Kajetany, next to Warsaw, there is a hospital and the headquarters, so the surgeries are provided here. And then if the patient needs to continue the treatment or to do the diagnostics, let's say, before the treatment, they can have these services, this offer in the places next to their home. So in Poland, there are 18 facilities, as I said, and in the world, there are facilities in such countries as Kazakhstan, in Shymkent. It is in the south of Kazakhstan, very nice city with very hospitable people. In Kyrgyzstan, in Osh, and the capital Bishkek. Also, we have 3 facilities in Ukraine, in Kiev, Odessa, and Lutsk. As everybody knows that now it's not very comfortable situation, not very good situation in Ukraine, but still we provide care for the patients, and we're trying to do our best in order not only to give the patients, good care, but also the support. And there is one more facility, not in Europe, not in Asia. It's in Africa, in Senegal, in the capital of Senegal, in Dakar. And what we do. So I said in a few sentences before that we provide care of patients with the ear, nose, larynx disorders and diseases and balance disorders. So we provide diagnostics, treatment of these disorders, both for children and grown-ups. And this care, this diagnostics and treatment is provided in all facilities that I mentioned before, but the surgeries are given only here in Kajetany, in this headquarters. So if we talk about foreign patients, of course, mostly they come to Kajetany to get the surgeries. There are also patients who come for the second opinion. There are patients who come for rehabilitation. This is very interesting because you can think that we can provide rehabilitation of hearing and speech for only for Polish patients, but it is not actually true. There are patients who come with different languages and they get this rehabilitation in their native language. So it is also something that is that makes us different from other centers. So it is complicated, complex care, starting with the diagnostics, treatment, surgeries if they are needed, and rehabilitation. Of course, we do the consultations, as I said, with the speech therapists, psychologists, but mostly psychologists, they are for Polish patients because of this language, and the idea is a little bit, it is a little bit complicated to do rehabilitation or do the consultation of the patient in different language. So as I said, diagnostics is important. So if we talk about foreign patients, when you would like to send or the patient would like to come to our center, so what we will start with, they are usually sending us some information about their, maybe they already have the diagnosis, maybe they don't, and they would like to check what is going on, and they just describe the problem that they have. We are getting this information in the International Cooperation Department. It can be either by email, WhatsApp, phone. You can send us a bird with the letter. So all sources are possible. We get this information. We prepare some kind of offer for the patient. We explain what we can offer, what we can do with this. Either we can treat or not. How long will it take? When we can accept this patient? And of course, the most important sometimes the price. So when the patient comes to to our center, to the center Medincus in Kajetany, we do the diagnostics one more time. Of course, we ask for, as I said, for this information before, but we believe that diagnostics is crucial and it is extremely important in order to give the proper treatment. So we repeat the diagnostics. We complete the diagnostics with all possible tests that are needed in this exact situation. So when the patient comes, he can come to the airport, he can come to the railway station, to the bus station by car. We meet the patient. Patient comes to Kajetany. There is a hotel here in the center, so he doesn't have to go anywhere else. And he stays here in this hotel, in this area, in this not medical area, but the recreational area with the swimming pool, restaurant, and so on. So they can also have some kind of rest here. So we do the diagnostics and we decide whether the treatment, what kind of pre-treatment is possible in this exact case. Usually if patient knows before what they're coming for, usually we organize the surgery at the same time. So we do, for example, 2-3 days diagnostics, and then there is the surgery, and then the rehabilitation. So usually after the surgery, patients stay here in Kajetany for about 1 week. That's why this recreational area is also important for them. So because 1 week is a lot of time, and they can, you know, have some rest, as I said, and do not get bored. After this rehabilitation, sometimes patients go home and they do not need any checkups, but usually, for example, in case of cochlear implantation, they need the care afterwards, the rehabilitation afterwards. And in this case, we get this telemedicine that is really, really useful. Having in mind, again, so many facilities that we have here in Poland and in other countries. So patients can go to their facility that is next to his home and get this telemedical offer, telemedical care. They are telefittings, telediagnostics, it's also possible, telerehabilitation and teleeducation. Telediagnostics is something that we are doing only in our facilities. For example, there are tests, hearing tests, subjective hearing tests that are done during the sleep of a child, and we check what hearing he has. It's not very difficult to do this test, but it is a little bit more complicated to give the proper diagnosis and to understand the test. So sometimes, for example, in our facility in Kazakhstan, in Shymkent, the technicians, they are taking the test and they're sending the results of the test to us, and more experienced professionals are interpreting this test, and we are giving them back the information, what they can do after with the patient. It is something very useful. They are not only giving, so it's not only useful for the patient, but it's also useful for our specialists, because by this they are learning. So it's not only, as I said, for the medical point of view, but also for educational point of view. So this is this telediagnostics, and we can say teleeducation. So this telefitting, as I mentioned before, it is something that we can provide in our facilities, and there are more than 13,000 patients that are under the care of the national, or we can say even international network of teleaudiology. And this is the system of remote fitting of the speech processor of the cochlear implant. So it is after the cochlear implantation, when the patient gets this cochlear implant, we cannot just turn it on with the maximum power, let's say. And the patient needs time in order to get used to the hearing, to learn how to hear. That's why we need time, and that's why we need time to adjust this implant, and we're giving him more and more and more power. In these easy words, we can say. So patients do not have to come here. They do not have to waste their time, waste their money. They can do this in the facility next to their home. We were doing researches, and there was also even PhD thesis made on the basis of this research that says that this kind of rehabilitation is safe, reliable, and fully accepted by the patients. So this teleaudiology network exists since 2009. There are different facilities, not only Medincus facilities are within this network, and we are cooperating with other countries in this sphere, and they can connect with us and be part of this network. And we're really inviting, and we are, open for the cooperation in this sphere. And this care and this network was awarded many times and got different awards. So, and one of the most the newest and something that we're really proud of, it is that our center was honored the European Private Hospital Award exactly for this initiative, the Best Patient-Centered Initiative, this network that we are providing the patients, that we are giving this opportunity to get their rehabilitation and this fitting within the network, within this group of centers, hospitals. It's not only one initiative that is worldwide. Also, we are doing screening, worldwide screening. It is something that we were doing from, I believe we started the worldwide screening about 13 years ago. So the beginning of school age screening was, of course, in Poland. And the idea is that newborn screening is done frequently in different countries. But with time, because of different diseases, because of different situations, the hearing can get worse. And unfortunately, it's not checked later on. So our idea is to do the screening of children who are going to school. They're first grade, they're going just to school, and we're checking if their hearing is okay. Because it is easier to check and to prevent than to treat later on more complicated disease. That is why we're sharing this idea first in Europe, then worldwide. As you can see on this slide, there are flags from different countries, especially in Africa, because there the number of children with of school ages, I mean 7, 8, 9 years old, the number of children with different hearing problems is it was extremely big. It was much bigger, much higher than, for example, in European countries. Me personally, I was going to different countries doing this hearing screening, and I remember the situation that there was a girl and teachers was saying oh, she's really noisy, she's she's screaming all the time, she's not a good student, she has bad marks. And when I did the screening, I found out that she was completely deaf on one ear, and neither teachers nor parents knew about that. And it was absolutely surprising for me and for them. And this it was shocking, of course. And after this hearing screening, we made the recommendation that these girls should go to a doctor, to a specialist, to continue, because we were doing just the screening. Yeah, it was not the diagnostics, it was the screening. So she needed to continue diagnostics and treatment later on. So if she knew before that there was some kind of problem, and they treated this problem before, she would be absolutely different child. She would have better grades. And this is the idea of giving all children equal opportunities of studying, because if you can't hear on one ear, so you are getting less information, you are studying worse. So it is absolutely shocking, and we believe that it is something that is worth mentioning and worth doing in different countries. In Poland, this program is going on every year, and children all over Poland are getting this kind of screening of hearing. We were doing this screening using different devices, and some of the devices are produced by us. These are this SPPS therapy, sense examination platform, sense examination capsule, and HearBox. And I will tell just a few words about each of it. So the first one, it is the stimulator of the polymodal sensory perception by Skaržinsky method. So what it is the device that is used for rehabilitation of patients with the central auditory process disorders. What it means? It means that a person, mostly they are children, young children, of starting from the 6 years old till, I don't know, 14, 15. They have good hearing, but they hear and they do not process the information. So it's like they're getting information and they are losing it. I'm afraid that this is the problem that are facing lots of children nowadays because of, phones, these TikToks, Instagram, and so on and so forth. So all this social media that are making their concentration worse. So this is something that we created, of course, based on the knowledge that was before, but we integrated this device using not only the hearing, but also the eyesight and also the touch. So it is the therapy that coordinates all the senses, and it can be used also at home. This therapy at the moment exists in 3 languages, in Polish, Russian, and English, and we are now cooperating with the centers in Argentina and also in Brazil, and preparing versions in Spanish and also Portuguese languages. So this is something that we can also cooperate with on the basis of this therapy with other centers. For example, we can produce French version of the therapy that can be used not only, of course, in France, but also in other countries that are using French language. Half of Africa using this language. Also, sense examination platform. This is another device that it is produced by us. This is the exact device that we were using for the hearing screening that I was telling you about before. So it is used to check, first of all, the most important, the hearing. And also there are some tests that are checking the speech and vision. Capsule, the sense examination capsule, is a little bit, let's say, not frequently used, unfortunately, but it is something that we are really proud of. It is the capsule that is used to do the early detection of sensory disorders. They are checking such disorders as are connected with the hearing, eyesight, the nose, the mouth, the taste, and their balance disorders. So the person can come in and they do not need any specialists, and they enter this capsule and they check all these senses that I mentioned. And they get the result whether they're okay or whether they need some kind of continuation of diagnostics and later on the treatment. And the Hear Box, it is the device that is used to conduct the hearing screening independently by the person, by the patient itself. So I was telling you in the beginning that we are doing tele-education for our specialists, but not only tele, we are doing different conferences and congresses. We're organizing these conferences and congresses here in Kajetany, in Warsaw. We are co-organizers of different specialist congresses. I will show you in a second some of them. And also we are participating in different conferences and congresses in scientific societies, in different, we are parts of different organizations. So here are like the most important conferences that we are organizing in 2025 and 2026. And we are really inviting you, or maybe the specialists that you are cooperating with, and you can tell them about these meetings that are going to happen this and the next year. So just to sum up and to finish my presentation, as I said, I think I said in the beginning that we already exist for 23 years. It's a lot of time, and we are doing a lot of work. We are specializing, talking about foreign patients, we are specializing in cochlear implantations and different complicated surgical procedures within the ENT. We are using telemedical technologies, as I said, and we're producing different equipment, things that are helping us in our job. So thank you very much. If you have any questions, I'm really open to answer. Thank you.
Thank you, Irina. Colleagues, you can switch on your microphone and ask questions, or you can write in the chat if you want. And while we're waiting for these questions, I have a few questions from agencies. They asked me to ask you because they were not able to join. So one of the questions, there are many patients who complain for tinnitus after COVID. Can the clinic help with this?
Mm-hmm. It is very interesting question, and there are lots of, as you said, and I think you're aware of that, there are lots of complications after COVID, and Professor Skarzyński was doing the research about that patients, it's some kind of problems that people faced after COVID. These patients are really complicated because it is something that is going on in there.
Sorry, the sound not good. Please repeat again. Patients.
They are complicated. They are really
no. What something happens with your connection? But it was good during presentation. Was connection very well.
Now is it okay? No.
Try to speak maybe slowly.
Okay, so the patients with the tinnitus in general, they are really complicated because they are patients who need not easy to treat because tinnitus it is not a disease, unfortunately. In the presentation, I even showed that we are going to have a huge conference dedicated to tinnitus. So it's a really complex problem. And we are inviting to this conference specialists from different specialties, not only ENT specialists, also dentists, something that is connected, general doctors. So it is a complex problem, and patients need complex care. So from our side, we are doing diagnostics. We are checking where this problem comes from. So it can be not only in the ear, it can be connected with the spine. Yeah, and in this case, we need orthopedics. Yeah, it can be connected also with the blood pressure. So there are lots of things that we can check, that we have to check. In complex, yeah, we can give some recommendations and the treatment. There are lots of patients like this, as I said, and we are treating these patients, and we are doing our best. But it is a really complex problem that needs, lots of specialists of different specializations.
Mm-hmm. Thank you. Irina, please check your connection again because sounds not good. Colleagues, do we have some questions if you want? If not, I will proceed with my question. Okay. So next question was like that. The child has had a hearing problem since the age of 3 after vaccination. Can you offer something without surgery?
Could you repeat? The child has problems since the vaccination, and I didn't hear. Yes,
after vaccination, the child had high fever, and something happens with nerves, and he become deaf. So, can you help this child without operation? Any methods?
It depends when it happened. So if this happened within a week, it is possible to do. It is possible to use pharmaceutical medicines. in order to help. For example, me personally, I had a situation after high fever and flu. I had partial deafness on one ear, and we were using medicine, special medicine, during 1 week after this, and my hearing came back and it's restored, and now it's fine. But if we say that it happened 1 month ago, unfortunately, the cells, the hearing cells, they can be destroyed forever, and they're only the surgery that can help, of course, depending on the level of the hearing, yeah? Whether it is the complete deafness or it is partial deafness. So, of course, this patient is welcome. I can share my details and contacts, and we can check whether we can help. But usually it is very important that even you, if you feel that something is wrong, do not wait. Just go to the doctor, to the specialist next to you, even not to our center, but somewhere who is close to you, and check, because time is crucial in this case. Yeah, if you do this very fast, within 1 week, within 10 days, we can restore hearing. If we wait, I understand that this is a child, and if it's a small child, he cannot, say that something is wrong. Yeah, but you can notice that he's like turning one ear and another is not working. So pay attention to these things, these parents. And in case of these patients, I'm waiting for the contact.
Yes, I will send this recording, and this agency will contact you, because I don't know the details, unfortunately. So next questions was like, how often should a patient come to the clinic after cochlear implantation?
According to our experience, usually we need about 4 to 5 such kind of meetings after cochlear implantation to get this implant work in its full power, let's say. And these meetings are organized by the engineer who is fitting, who is adjusting this cochlear implant. He decides how often this patient needs. Usually it goes like this: like after the surgery, we have we turn on this process, and we turn on this cochlear implant. The patient comes after 1 month, then after 3 months, then after 4 months, and then after half a year. And after this, within this 1 year, we have like full power of this cochlear implant, and later we need just check up once a year, once 2 years, so not so often. And as I said during my presentation, thanks to the telemedicine, we can do this on distance, so we can make these adjustments on distance.
Okay, thank you. And last question, in what languages do you offer services to children with speech problems, and how long they need to stay in your clinic?
There are speech specialists, speech therapists in our clinic who speak, of course, Polish and also Russian language. There are 2 languages that we provide rehabilitation. So, but they are Polish specialists. They are fluent in if somebody needs it in Russian, and also we have a speech therapist who is English speaking. With this rehabilitation, that it takes time. So it means that the patient has to stay for some time here. For example, fortunately, because of the war, there are lots of patients in Ukraine, moved from Ukraine to Poland. And now we are providing them with this, because the patient that still need rehabilitation, and we are providing rehabilitation either in Russian or in Polish, because children are very fast, and they are learning very, very fast, and they are learning languages very fast. So yeah, you probably know that. Then there are mothers who don't speak and have child who speaks fluently already Polish language, and they can speak very quickly and nicely.
Thank you, Irina, and thank you, everyone. We can finish our session, and please be in touch. Everyone who were registered will get recording, will get contact of Irina, and she will send you all information that you need. And keep in touch.
Thank you. Bye bye.